back and forth. At the end of the day, I had to really think about what my values were and my beliefs, and which scope of practice was really going to suit what my beliefs and my values were, and I chose counselling psychology. I've never regretted that. It's prepared me fully to be a practicing psychologist. I can work anywhere that I want to. I work alongside educational psychs, I work alongside clinical psychs, I work alongside ABI psychs, I work alongside neuropsychologists. So I'm pretty much prepared to work alongside anyone or any organization. How long does it take for you to train? I think mandatory, it takes about 6 years. I did a conjoint degree in public health and psychology at AUT, so I added on another 2 years on top of my training because I had to do some additional papers in public health. You do your normal Bachelor of Psychology, and then you do a year's honours, which is quite a big, large cohort of students. And you will do your honours sometimes with other people from other schools in the university. And then a very small group of students are picked to train as part of the master's program. And typically, if you join the master's program and you're picked, you are typically going to move on to the internship year and do your postgraduate diploma. Unless something happens, you decide to drop out of the master's year, you're pretty much guaranteed to go into the internship year. What does the internship look like? I think just like what Michelle said, it is relentless, absolutely relentless. I don't think I've ever worked as hard as I did, and I also had 3 children to boot. I also became a student rep while I was in my internship year, and just like these student reps, I worked just as hard as they did. I would recommend you become a student rep. It's an awesome job. I think you get to meet so many people and you'll have your fingers in lots of different pies, and it's a great place and a great start to become a psychologist. In the master's year, you do a 3 months placement, and I did mine in a community acute mental health residential place down in West Auckland for mental health patients with psychosis and schizophrenia. And I think that sort of really, what that showed me is that counselling psychologists can pretty much work anywhere if they want to. If you've got the interest and you've got the drive, you can pretty much do that too. What that placement showed me was that actually I picked the right scope. I didn't want to work with psychosis and schizophrenia. I really wanted to work with more healthier patients. I currently work as a psychologist for Oranga Tamariki, and what can I say about my job? My job is the most rewarding job I have ever done. It's also one of the most challenging jobs I've ever done. I work across very young children, as young as 1 year old, all the way to children actually as old as 17, 18. My work is diverse. I work with diverse communities and cultures. I work with diverse professionals across organizations. I don't have a typical day. So these are all the things I do within my role. I'm 1 day a week I practice as a consultant psychology at one of the Oranga Tamariki sites, and my role there is to work hand in hand and side by side with social workers to ensure that children are safe within their homes and safe within their environments. Aside from as a consultant psychology at sites, I also work as a forensic interviewer and support the police as well as the police in doing forensic interviews with children who come in to give evidential interviews for either sexual abuse or physical abuse. So that's one part of the role. I also support pediatricians for children who may have come in for non-accidental injuries. So we work side by side with police and staff at Starship Hospital. We then develop safety plans for what would happen to a child should that child move back home or within the community. I also do therapeutic work with children. I'm trained in play-based therapies, as well as just all the other types of modalities. I also, in fact, a huge part of my job is doing assessments. So I do specialist assessment and psychological assessments for children who have suffered significant trauma. I also do assessments to assess for parental capacities. So typically, when a child has been taken out of a parent's home, the family home, the state will sometimes take what we call orders. And part of the process of getting that child back to the family is that sometimes social workers ask us to do assessments to see whether or not it's safe for that child to enter back into the home. And so we undertake that work. Often that work takes me to court where I have to present my reports. That's also pretty challenging as well. So as you can see, as a counselling psychologist, you can pretty much work anywhere you want to work. I think that if you've got the drive and you've got the passion, I think that it really doesn't really matter which path you want to go on. I think you'll have a really fulfilling and a worthwhile career. I've never regretted it. I've never regretted being a counselling psychologist. And I just very thankful that it brought me to where I am now.